Finding the right autism treatment. Parents are using nearly 400 different treatments for their children with autism. They can't all be wrong, they can't all be right. The pace of scientific research is frustratingly slow. Many treatments that seem to make sense and that other parents swear by haven't been proven effective or safe, ineffective or harmful. Compounding this confusion, ready to offer spurious cures. Quite a number of these children are on more than 30 or 40 treatments at any given time, not including everything else they may have tried and stopped using. One child is on 56 treatments at one time. At the heart of the issue is the fact that what most people call autism is actually a spectrum of disorders that may or may not turn out to have different causes. That's why experts prefer the term autism spectrum disorder or ASD. Normally, this includes the specific diagnosis of autistic disorder, Asperger's syndrome, and pervasive developmental disorder, not otherwise specified, or PDD-NOS, and pervasive developmental disorder, not otherwise specified. One thing that complicates autism research is that different autism spectrum disorders may turn out to have different causes, may respond better to different treatments, and perhaps one day will have different cures. Today, however, ASD has no known cause, no one-size-fits-all treatment, and no cure. Earlier autism treatment is better autism treatment. Perhaps the biggest breakthrough in autism treatment to date is the recognition that pediatricians can identify most, but not all, 24-month-old and even 12-month-old children with autism. Why is this such a big deal? Just about everybody agrees that whatever it is that goes wrong in autism goes wrong in the brain. And while a child's brain continues to develop through the teen years, the most intensive period of change is the early years of life. And now researchers are finding effective treatments for young children. One is Rebecca Landa, PhD director of the Center for Autism and Related Disorders and the REACH research program at Baltimore Kennedy Krieger's Institute, which extends individualized, behavior-oriented autism treatment to 2-year-old children. At this age, most children with autism get a weekly or monthly visit from a therapist who train parents to do behavioral interventions in the child's natural environment, in which a small number of children get both one-on-one and group experiences. This is a challenge for any child this young, but a particular challenge for kids with autism who face a range of problems with communication and social skills. They may have trouble learning to talk, imitating others, sharing emotions, and paying attention. They may show interest in a very few things. They may engage in repetitive, self-stimulating behaviors, which parents and autism professionals often call stimming.